Welcome to the Diversity and Inclusion on Air podcast. This podcast is a program of the Association of American Veterinary Medical Colleges Diversity Matters Initiative. The podcast explores various issues related to diversity and inclusion in the veterinary profession and provides AAVMC an opportunity to offer ongoing diversity programming to our member institutions as well as all veterinary professionals. My name is Lisa Greenhill, and I'm the Senior Director for Institutional Research and Diversity at the AAVMC. So I'm very excited about this episode. It's part 2 of our Assistance Animals series, and I'm delighted to be joined by Dr. Meghan Herron. Hopefully I'm pronouncing that correctly.
You are.
Great. She is the Clinical Associate Professor of Behavioral Medicine at The Ohio State University's College of Veterinary Medicine. On episode 31, I was joined by Scott Lissner, the ADA Compliance Officer at Ohio State, and we talked at length about assistance animals and the legal protections granted to individuals who use them. So today we're going to talk a bit about the behaviors that we can expect to see with these types of animals. So as is our custom, I would invite my guest, Dr. Heron, to tell us a little bit about herself.
Hi. Thanks, Lisa. Thanks for having me today. So a little bit about myself. So as you mentioned, I'm a associate professor at The Ohio State University College of Veterinary Medicine. I've been here for about a decade, and I am fortunate enough to be able to teach veterinary students as they are learning to become veterinarians, both in their first year, second year, third year, and fourth year. So they really can't escape vet school without me. And really trying to impart basic knowledge and skills on animal behavior. My focus is primarily small animal, meaning dogs and cats. And but we also do teach a broad range of behavior in other species, mostly domestic species, horses, cows, pigs, that sort of thing. But my focus is on small animal behavior. And clinically, so I actually see patients. I see dogs and cats for behavior problems with their owners most days of the week in our clinic. So I have both aspects of that. And we also allow students to shadow those appointments so they can learn and be able to sometimes treat those same cases when they graduate.
Great. Well, that sounds really cool. So, especially as the doggy parent of a terrier with severe separation anxiety.
There you go. See a lot of that for sure.
So why don't we dive right in? So how are service animals generally selected and trained? So we know, I think that the last couple of years, shows like the Today Show had kind of a assistance or service dog training in dog in residence on the show, kind of living there and being on camera and being socialized and all of those kinds of things. But kind of what happens before all of that? How do folks kind of select for that? And then what is involved in the training to kind of get the behaviors that we're looking for?
Mm-hmm. Well, before training even starts, the planning starts before the animal's born. So if you're looking at canine assistance animals specifically, I mean, there are breeding programs where they are very carefully selecting parents with very specific, very docile personalities. I mean, docility is really, really needed for these dogs to be able to tolerate all sorts of different environments, to be able to be comfortable with an assortment of different people of all ages, disabilities, abilities, behaviors, right? Some might be more erratic than others and unpredictable, but they really need to be, I guess, bomb-proof is the best way to say it. And that starts with genetics, really. Trying their best to look for dogs who are just predisposed to having very docile, very tolerant, very calm personalities. And intelligence, clearly, these dogs are very smart and they need to work on the spot and to be able to learn all sorts of different cues, even nonverbal ones, right? So they can understand and read people very well and know how to interact and what to do next without necessarily having to be told. So then once those pups are selected, they go through a very rigorous socialization program, as you mentioned on the Today Show. So socialization, for those of you who aren't familiar, is a period of time in a dog's life where the brain is a sponge, where they need to learn that everything in life is safe. That's going to be different types of people with different types of behaviors, different environments, different floorings, different lighting, both indoor and outdoor environments. Just think of anything a dog could see, smell, hear, or feel or experience in its life. And you want to try to cram that all in during those early weeks. So again, about 3 to 12 weeks of age is that time frame. Now, clearly at 3 weeks of age, they're just barely walking and able to see and hear. So typically they're with mom and littermates, because there's a lot to gain from mom and littermates, from inner dog skills, because they're going to encounter other dogs later in life. So they want to be socialized well and not be fearful or reactive to other dogs that they might see out on a walk. But typically they're getting into a home of a puppy raiser who's spending time with them, taking them everywhere with them. When we've had vet students here that are trained service dogs, and they're bringing them to class with them as part of that training. And I see them all over campus. It's really nice to see, their service dogs. That's these little puppies just kind of training and getting their exposure. So it's an exposure, but it's also training. So they're working on teaching them to walk on a leash, teaching them to walk closely. The learning starts, the second they enter that puppy raiser's home. And as far as I'm familiar, at least the facilities that I have visited or worked with before, typically that puppy raising, it takes up to a year and a half, and you're not typically seeing a service dog go with their client or their companion until they're a year and a half, 2 years of age. So I've been to these graduations before. They're very they're tear jerkers for sure. You see the puppy raisers very proud of their doggy, getting paired with their person, and it's just a special moment, that these patients have been waiting for, and it just opens the world of opportunity for them that they wouldn't have had without this assistance animal. And then they try to match them. Really, they're looking at the different personalities, and clearly some of those puppies never make it to that phase. It's pretty rigorous. They really need to be bomb-proof, tolerant, calm, have that ability to learn and anticipate the needs of their handler. And it's an extraordinary animal to be able to do that. Really extraordinary. It's really not normal to be honest, to be able to be a service dog like that. I have people come to me, how do I get my dog to be my service animal or my assistance animal? Being able to, not necessarily emotional assistance, but for, physical assistance. I said, well, that ship's kind of sailed. These dogs that you see out there were purpose bred and hand reared from day one to have that job. So it's really hard, to start with a dog who's 2 or 3 years of age and say, we're going to make you this service dog. Not that it's impossible, but it's very, very difficult to really be the dogs you see out there.
All right.
Service animals.
So it sounds like you're really describing service animals. So, yeah. And that's kind of what I limited that first question to. So, So what about emotional support animals? These are animals that I guess the cues that they take are kind of different than service animals. The function that they take is a bit different. But we're also seeing a lot of different kinds of animals being used as emotional support animals. So is there a training? What kind of expectations do people have related to behavior for those groups?
Right. And so I would say, I think service animals probably also serves a great deal of emotional support to their handlers, but their main purpose is physical assistance, right? Whether someone has a visual deficit or an ambulatory deficit, these dogs are helping them complete those tasks and to function in, an environment that they may not be able to. Whereas an emotional support animal is different. They're not typically the dog that's picking up your keys, turning on a light switch for you, grabbing a water out of the fridge for you. This is more emotional support. And again, talking about opening the window of opportunity for patients and people, there's a lot of people who really can't face the world without that type of emotional support. And these dogs or other animals are really giving them that ability to cope and to open up opportunities for them that they never would have had without it. So I am very supportive of that, being an option. That said, you don't see the rigor as far as selection. These are typically self-selected. So, it's their pet. It's their animal. Some of them they may have raised from a puppy. Some they may have just picked up from a shelter last week. So there's really not any rigor into looking at the genetics, looking at the overall behavior or training level. It's self-selecting. If you can't really tell someone, this is your dog, this is the dog that makes you feel better, right? You right. Self-select that. You self-select your emotional support, which is typically a pet that may not have necessarily been chosen for that purpose. Sometimes they discover how helpful it has been for them and they make them an emotional support animal. But again, I'm sure there are people who purposely are looking to find a match for them. And, if people recognize that and have that ability, then getting help to choose the right animal for that role would be ideal. But my guess, and again, this is just an assumption, is that that's typically not the case. It's typically self-selecting a pet that they already have. And there's a discovery of what sort of emotional support that pet gives them, and the ability and opportunity opens up for them. We now have this kind of ability, this window that allows people to then bring those animals with them into places that don't typically allow pets. And so there isn't right now any sort of official training, official certification. It's based on the human, the person, having a diagnosis that part of that treatment is having an emotional assistance animal with them. And so as long as that is signed off by an appropriate psychological authority, then they are able to bring that animal with them. Now it's going to be dependent on airlines, dependent on, different places where they're taking them, what they allow, and also what sort of health guarantee, whether there's a health certificate required. I mean, technically speaking, crossing state lines, you should have a signed health certificate by a veterinarian. But again, that's going to be up to the airlines. That's going to be up to the establishments that are taking these animals.
Sure.
So, but you don't see, to answer your question, there is not a training program. There is not the rigor that you would see with the service animal. It's typically self-selected.
Right. And so, how, as someone who studies and works in animal behavior, recognizing that, they serve many different, emotional support roles for individuals. What are some of the things that you might suggest to clients very broadly, that they look for? I mean, when Scott and I chatted on episode 31, it was actually the week of the Peacock scandal.
Oh.
And and I laugh, but apparently, this person had this bird, and the bird served some emotional function for her. And I recognize I'm not a veterinarian. I recognize for a lot of lay folks or folks that are not working in that particular space that seemed a bit of a stretch for some of us. I've only seen peacocks in zoos, and they don't seem to be very caring, warm and fuzzy animals. But that was my limited exposure. So
Great.
what kinds of things, for this particular, knowing that on the service animal side that there's so much investment on the front end being prior to conception. So for folks that are looking to either, identify their existing animal as potential service trainable, or they're looking for this particular type of support, emotional support, what are some of the things that you might suggest to clients very broadly that they look for?
Sure. And I think the unfortunate thing is that's not necessarily a concept that's emphasized. It's a conversation between, their psychological healthcare provider and the patient, and making a decision that this animal provides me that emotional support, but there's not a lot of attention given. Is this the right animal? Is this animal fit for that type of job? And I think a lot of that's going to vary on what sort of emotional support is this animal providing and where. I mean, are we just talking about being able to go out to dinner? Are we talking about going on an airplane? Are we talking about going to a movie theater? Are we walking through heavy traffic? Are we going in the car, right? So, and I think that the issue is that your average dog maybe not best equipped to cope with abrupt changes, unpredictable interactions, loud noises. So I see a lot of dogs with noise fears and noise phobias who might startle. You also want to think about, if there are other animals also present, there are other service animals, or even walking, down the hall. If they are fearful of other people, of other animals, they could then potentially be reactive or aggressive. And so I tell people to really think about what the job they need, where do they want to be able to take this animal, and think about what the animal's going to experience. What are they going to see? What are they going to hear? What are they going to smell? Who's going to touch them? If so, when and where? And what's that experience going to be like? And let's walk through this animal's previous history and think, how does that animal cope well? And I think trying to create some empathy between patients and animal, because you think about if they're looking for emotional support, do they really want to put their animal, who is, really the center of their lives, in a situation that causes them emotional distress? And so I think a lot of people forget to think of it from that aspect. And I think that's important, that some of these dogs don't cope well being on an airplane, don't cope well being around a lot of strangers. And particularly if they are a small dog that's not really gone anywhere as a puppy and is used to sitting on someone's lap, may not be comfortable sitting on an airplane next to another stranger, or walking around an environment where they could bolt, they could panic, they could get scared and run away and then be lost. I mean, that's something that a service dog is trained and screened to never happen. And even in the best of service dogs, sometimes those things happen.
Sure.
And so you take an emotional support animal, he may not have that rigor or that docility or ability to really cope in the situation. So I really try to have people empathize with their own pets and think about, what are they going to experience, and is this the right pet for that? Because it doesn't mean they have to get rid of that pet. It just may mean they need to think about selecting another animal who can cohabitate with that current pet to also be their support animal, taking them away from the home. And that's hard, and that's often not practical. They may not be able to, or there's one particular pet that is really their true provider of emotional support. And so we have to think about making wise choices for them. I think, what I really like about the service dog is that there's always kind of clear signage and vest saying service animal, and people respect that. You don't see people going up trying to pet a service animal, putting their face in a service animal's face, or interfering at all. You don't even have to pet those animals. They're working. Yeah. And I worry that with an emotional support animal, you don't see that signage. There's no regulation on a vest or a collar or anything that says this is a service animal or support animal, because I really feel like the general public should respect those same boundaries as they would a service animal, because we really don't know this animal is going to tolerate a stranger trying to pet it, or kids coming up and trying to hug the dog. And that patient may not know it. They may generally not be aware if their dog is okay with that. I mean, it takes a while. We don't speak dog. You have to learn how to read body language, interpret their behavior. And so your average person may not recognize when a dog is fearful or scared or not wanting to be touched. But if we just all were able to respect those boundaries like we did a service animal, I think that would help a lot for these dogs and their owners.
Mm-hmm, mm-hmm. Thank you. So what are some of those? I mean, you kind of alluded to some of the challenges behaviorally that may occur, but what are some of those challenges that you've seen maybe with assistance animals of various kinds, and included in that, not just the behavior, but I guess the signage is an important part, and I think that a lot of times the lay public may be able to clearly delineate kind of a service animal from an emotional support animal, just because I think that culturally we are attuned to the fact that, well, one, they typically be a certain breeds, right? And we see them so calm. Mm-hmm. But with the proliferation of the ability, I guess, to get these vests, these you can just go on Amazon, get a vest and pop it on. What are some of the challenges with these things that maybe you've seen out in the field?
Mm-hmm. Well, and to be honest, sometimes they're helpful for some of our patients who really don't want strangers petting them. And I will admit, some of our owners, based on our advice, will use those vests to keep people at a distance because it works. It's one of the few things that actually keeps people at a distance. So I actually don't have a problem with the proliferation of it if it actually keeps people away, unless it sort of dilutes that and then causes people to not really, think, oh, it's not real, a real service dog, so it's okay for me to invade its space or pet it. And I think, a lot of these pets, it's, as you say, they're not the typical Labrador, they're not the typical Golden Retriever standard breed, and a lot of them are smaller. I mean, that's at least been my experience. A lot of them are small dogs. Mm-hmm. They're cute dogs, so children are drawn to them, other people are drawn to them, and they assume small dogs like puppies. Small dog must be friendly. Small dog wants me to touch it. Yeah. So that signage is helpful. But I do think some sort of regulation, and even if it's online coursework or some sort of training to help people who are going to take their animal as an emotional support animal, you know, how do you read their body language? How do you know what's a good environment for that dog to be in? How do you know if that dog is safe? I mean, some dogs will bite people if they get too close to them. And then you have a public safety risk there, and who's responsible and who's going to be liable for that. And I think that's what puts some of these airlines in a really tough position, right? Because there isn't a way to guarantee that. And I know they've been working with, you know, trying to have position statements and have veterinarians, but there's not really a good way for a veterinarian to do a 5-minute exam and say, I can guarantee you this dog's not going to bite someone. You could never give that guarantee with any dog. Right. So I really think it's about personal education of what is behavior, what does body language look like. Here are the signs of distress, not just from a public safety standpoint, but also from an empathy standpoint of this is an emotional support animal. You should want your animal to also be in emotionally good health as well and have them in experiences where they're not under distress, which is for their own welfare. And I just think a lot of people just aren't aware. It's not about intentionally being cruel or mean or putting their animal in situations that is not good for their welfare. It's just a matter of lack of knowledge. It's just not out there. And so trying to develop strategies to give that sort of education to these people of A, determining if their pet really is appropriate for this, and A, is it safe, and B, going to be okay for their welfare to serve that purpose. And if so, and maybe there are unique things that we can help. Maybe we can help, you know, these animals learn to cope with certain sounds that bother them, or learn strategies that they can take cues off of their owner to cope better and to not be afraid, and to have, say, treats with them to provide to an animal if they're on a bus where they're a little bit frightened, and work through some of those fears rather than just saying, you know, just sit here and deal with it. And a lot of people don't have those tools. They don't know without meeting with a professional, really, what's the way to do that. And so having resources to help them, I think, is great. Or some sort of, you know, starter kit, I guess, which I'm not really aware of anything other than this animal provides me support. I find a psychological healthcare provider who can sign off that this is okay. And then they're just left with little to no guidance, which is unfortunate. So hopefully that's on the verge of changing.
Yeah, well, I was just about to say, it sounds like there's a place in the profession to kind of bridge this gap, that there's not just a place, but there's really a need for the kind of mental health professional and the mental health professional and the veterinarian to really be on the same team to kind of help individuals who have identified a need for an assistance animal of some type to really be educated and informed about, you know, that need for the animal, what kind of animal, that behaviors to look for, all of those kinds of things. And it doesn't sound like either professional group independently is able to kind of like it really does need effort, There's a real opportunity there to help individuals develop some skills to help themselves to actually to regain some control over their lives.
Agreed.
So one of the reasons that we're talking about this is because we are seeing an increase in the number of assistance animals, and specifically emotional support animals within the veterinary colleges. And this is something that I think a lot of schools are trying to figure out how to navigate in a way that not only is supportive and legal and all of those kinds of things, but also is able to offer the necessary protections for everyone else, animals and humans in those spaces. And so when students emerge into the clinical component of the learning experience, then there tend to be some unique challenges about bringing another set of animals around. So I'm curious what your advice or what your thoughts are on what colleges should consider around animal behavior and working with ADA compliance offices, for approval of animals in those settings.
Sure, and I think some of that's going to depend on what level of approval can they have. If you look another aspect of assistance animal we haven't talked about are therapy dogs.
Oh, right. Sure.
These are dogs they actually do have to go through a certification, and it's typically an owner taking their pet to be a therapy dog for others. So it may be and typically it's an emotional support. It's helpful for them. It calms their stress. It's just a nice break for them to have that emotional connection with an animal. And there is regulation over that. So there are Delta Society and there's other service dog, where they actually have to demonstrate a certain level of obedience training and an ability to be calm and non-reactive in many situations. And even then, I see a lot of therapy dogs that are not necessarily comfortable with that job. So there's definitely room for improvement there. So perhaps, and again, it just depends what's really legal. Can there be some sort of certification process that there's a minimum standard in order to be safe around a large group of students, so that, because who's liable for that? If that dog bites another student, who's responsible for that? Probably the university, unfortunately. So is there a way, can they have some, again, not super strict or harsh, just a little bit of kind of check a few boxes to make sure your dog is safe to be in this situation? And just like we have with the therapy dogs, having some behavior professional being able to kind of assess, again, not ever giving a guarantee, but to say at least we've checked the boxes to feel like this animal is not demonstrating that they are a high threat to others. And then potentially there's seating, just like we have for other, special needs students. There's certain seating areas. So here's an area that gives you and your dog space, or maybe it's not a dog, maybe it's a peacock or something else, that gives you that space from others, and that there are boundaries that are respected. So there are clear rules about this emotional support animal. It's not an animal we're petting. It's not one we're passing around. There's a special seating area, not to ostracize that person, but just to allow that animal to have space. It seems to me it would be helpful. And then the other thing is you have to think about safety, but also hygiene, house training. Right? You hear that story of the dog running down the aisle and pooping right in the middle of the plane, right?
Right.
So that's disturbing to people, and B, if they aren't under proper parasite control, there's a public health risk there for zoonotic disease as well. So you want to think about that. And, my thought is that there's some sort of health certificate for these dogs that they carry around, not just that this is an emotional support dog, but also this is a healthy dog. So it's been checked for gastrointestinal parasites, has been fully vaccinated, is basically checked over for any potential for zoonotic disease transmission. And that's going to include flea and tick prevention, right? Because you don't want to bring a dog and spread fleas around, the classroom. So I think there's probably some health parameters we need to look at as well.
All right. Wow, that's a lot, but really important.
Yeah.
So one of the things I think that you mentioned earlier was about veterinarians and their kind of treatment of assistance animals. And certainly in your job, you see a lot of animals. I don't know how many service animals you come across in your position at Ohio State. But what should veterinarians who are just kind of out in the field with their companion animal practices, maybe not having the depth of knowledge around behavior, such as yourself, who spends all of her time working on that, what are some of the things that those folks should know around treating assistance animals and also providing support for their clients with various kinds of assistance animals?
Absolutely. And I think the way, they treat their general health would be like they would any other patient. I think educating their client, whether that's through in-person education, through handouts, through books, through other literature. I mean, learning to read and interpret body language is one of the biggest ones. Recognizing signs of distress, just having an open conversation about, all right, what are your plans for this animal? What environments do you want to have this animal in? What sort of exposure do you anticipate? And let's talk about how has your dog reacted in those situations previously? And just sort of maybe a questionnaire could be developed over, here's sort of the boxes of high likely stimuli to cause fear or to cause worry or reaction, and kind of looking for red flags. And if any of those boxes are checked, then we need to talk about that and think, well, are we going to have this dog in an environment, say loud trucks is a trigger for this dog to become scared and potentially panic and run away? Okay, well, where are we going to go? Are we going to go in a situation where there's going to be a loud truck or anything loud? yes, let's talk about that. And then helping them find resources. If they themselves don't feel they have the behavioral expertise to give them a plan to work through that, getting them connected with a professional who can help them work through that. Because just because that fear is there doesn't mean they can't function. It just means we've got some hurdles to get over for them to be successful. And then that professional can help decide when they're ready and have overcome that particular fear. Some of which, if they're mild, can probably be overcome, and others that are severe may not be. And we may have to have that difficult decision with that owner of whether this dog can actually play that role for them. But, talking to them, educating them about zoonotic diseases and how important it is to have them under appropriate flea control, monthly deworming, so that's not an issue. And then really, talking to them about signage. I think signage is really important so that people respect those boundaries. And again, they may not know that it's available to them. It's not like they're handed a kit of, here's your emotional support animal. Here's all the things you need to know. Here's the signage you need to use. So if veterinarians can help provide that as a resource, I think that would be very helpful.
That's great recommendation. So anything else that you would want folks in the profession, or especially pre-veterinary students? We have a lot of pre-vet students who are interested in these issues, both kind of personally from the service animal or assistance animal perspective, but also kind of long-term thinking about careers in the profession, and maybe behavior is one of those things. Any wise counsel for those folks?
Sure. I mean, I think it's great. Like I said, we have undergraduate students here who you can see them as puppy raisers, and I think that's fantastic that they want to be involved. It's such a great cause, and it's really, really helpful, and I think very rewarding for them. I think there's also, there's a lot of stigma, I think, when you talk about emotional support animal. There's a stigma against that person of, oh, why do you need to take your dog everywhere? It's the sad thing about mental health and the public perception of that. And so trying to look at that with empathy, rather than judgment, is one of my first pieces of advice. And then, I guess one of the sad things, and probably a factor in that, is that probably this label of ESA is getting a bit abused. So there are people who will find a way to get that signed letter that may not actually qualify or not need it. It's a way to be able to sneak your pet into places. And my hope is that is the exception to the rule, because I would hate to see that spoil it for the people who really do have wonders of opportunity open for them by having that assistance animal. So just having an open mind, having understanding and empathy, and respecting boundaries for those pets would probably be my top advice.
That is great. Thank you so much, Megan, for spending a little time with us.
My pleasure.
AAVMC appreciates your time, and we are really just so glad to be able to continue this discussion. I think it's an important one in the profession very broadly, but one that really, as you said a couple of times, it really opens a world for individuals who are in need of additional emotional and or physical support with these various kinds of animals. So thank you for the work that you do.
You're welcome.
We really appreciate it.
It's my pleasure. Take care.
Great. Thank you. And so with that, we will wrap another episode of Diversity and Inclusion on Air. Be sure to check out the show on YouTube for our back episodes, as well as SoundCloud, iTunes, Stitcher, and any of the other podcast apps. You can also find more information about the show, as well as other issues related to diversity and inclusion in the veterinary profession on the show's Facebook page, which you can find at AAVMC Diversity and Inclusion on Air on Facebook. With that, we will end this show. Thank you again, Dr. Heron. We really appreciate your taking some time to spend chatting about this. Thanks.